Hello everyone, Dr. Paul Kilgore here with breaking news for you on the relationship between niacin, a vitamin, and the metabolites of niacin that may be linked to cardiovascular disease. In fact, from the study that we're going to talk about, it does appear as though there's quite a strong linkage. So today what I want to talk about is a paper that came out just yesterday in a well-known journal, very prestigious journal called Nature Medicine. It was published February 19th, 2024, and because it was just published yesterday, this is very much hot off the press. One of the things I want to point out to you is that in this particular study, they did multiple studies within a study. So I'm going to try to tease out for you some of the key points that I think you'll need to take away from this particular study. So the first thing to know is that the paper is actually talking about the relationship between vitamin niacin, or B3, vitamin B3. Vitamin B3, as you may know, is also known as nicotinic acid. Niacin is not a true vitamin because it actually can be synthesized from food that you eat, from the amino acid tryptophan. Niacin plays a key role in the conversion of carbohydrates into glucose and also is key to the metabolism of proteins and fats in your body. Niacin is also key to helping make sure that your nervous system is functioning smoothly and also helps your body produce sex and other hormones, stress-related hormones, and improves blood flow. When we have a niacin deficiency, this is a condition that we call pellagra or pellagra. And pellagra was quite common back in the early part of the 20th century, and this is during the Great Depression when food was scarce for a lot of people and nutrition and intake of key vital nutrients was low. Pellagra can be associated with symptoms of diarrhea, dementia, also sores in the mouth can develop, and there can be a skin condition or skin rash can develop as well. In the 1930s and 40s, specific disease conditions were identified that were associated with low vitamin levels, and one of them was niacin. So in the aftermath of these investigations, it was determined that these vitamins could be added to food, and one of the foods that they have been added to is flour. So flour has been enriched with several vitamins, including niacin, so that now most of the U.S. population has very adequate levels of niacin and other vitamins, such as the B vitamins added now to flour. So now flour is enriched with 5 key nutrients, including niacin, thiamine, riboflavin, folate, and iron. It was decided that flour should be enriched with these vitamins because during the processing of flour into refined flour, or white flour as you may see it in the store, it's determined that these minerals do get lost in that processing. So adding back these vitamins helps people make sure that they get adequate levels of these nutrients. Standardized flour enrichment now ensures that we get these 5 nutrients on a regular basis when we consume products made with this flour. The niacin structure is fairly simple, but one of the key things to know is that there are 2 metabolites, 2-PY and 4-PY, that are produced as a result of the metabolism of niacin in your body. So the study from the Cleveland Clinic was very important also because it identified one gene that's been associated with the production of these metabolites when we have breakdown of niacin in our bodies, the 2-PY and the 4-PY. This gene is called ACMSD, and in the screen there you can see the long form of this. It's an acronym, but this gene is very, very important for many people because when they have that gene, they will then make these metabolites from niacin, the 2-PY and the 4-PY. One of the most important thoughts that comes from this article, this study, is that 4-PY is associated with an increase in a vascular endothelial protein. And one of the important features of this protein is that it can actually increase the number of white blood cells that attach to our blood vessels, the lining of our blood vessels that we call the endothelium. The name of this molecule is the vascular adhesion molecule 1, or VCAM1. VCAM1 is known as a key participant in the process of inflammation in your blood vessels, and this applies to the coronary arteries in your heart as well. One key observation that comes from this study at the Cleveland Clinic is that 4-PY, but not 2-PY, is associated with an increase in the migration of white blood cells and the adherence of these white blood cells to the lining of your blood vessels. One of the things that this entire process does is makes the white blood cells sticky, and so they will adhere to the inner surface, that endothelial lining of your blood vessels. This graphic here illustrates this process whereby we have the migration of white blood cells to the endothelium in the lining, and as a result, over time, that will lead to the gathering of the white blood cells, inflammatory markers or cytokines. These mediators will then also draw in other constituents, including things like cholesterol that are circulating in your blood or serum. And over time, this will lead to growth of the plaques or atheroma that are lining the blood vessels. These blood vessels that get affected particularly are those in your heart. One thing that happens with 4-PY and the VCAM1 and the drawing in of these white blood cells to your blood vessels is the growth of these atheroma or plaques lining your blood vessels. These are the plaques that grow out of the endothelium, and they result from the process of inflammation that's occurring on the inside of your blood vessels as a result of this process, the VCAM1 particularly drawing in the white blood cells, making them sticky. And when they stick to your inner lining of the blood vessel, we know that you're going to have growth of these plaques. So vascular adhesion molecule 1, or VCAM1, is a key factor in this entire process of inflammation in your blood vessels. So it's something we all need to be really aware of. When this process continues onward for many months or years, undoubtedly one of the things that will happen is a growth in the plaques lining your blood vessels. And when we get into trouble in our coronary arteries, when these plaques grow to the point where they block the blood vessel, that's where we become at risk for heart disease, including things like a heart attack or even blockage of an entire blood vessel leading to heart attack and then death. So it's very important to make sure that we understand what our status is, and we need to understand this process of how niacin is impacting the metabolites and then leading to inflammation in these blood vessels. In this diagram, you can see notations of the different cytokines that are acting on the linings of your blood vessels. And one of the things to note is that there are many different factors that will lead up to the formation of this plaque, but certainly niacin and its metabolites have an important role now that we didn't really understand fully before. These plaques that I've been talking about, the atherogenic plaques that are very important, they grow on the inside of your blood vessels, are really bringing in white blood cells that we call macrophages. These macrophages are very important because they interact with other cells in our immune system, but they also are interacting with VCAM1, and this process that's set up in inflammation in the blood vessel is going to keep drawing in these macrophages if the inflammation continues. In the diagram that I showed previously, a central character in all of this is the interleukin-1 beta. So interleukin-1 beta is an important cytokine. We know it as a very pro-inflammatory cytokine. So one of the things we certainly want to do as we think about the impact of niacin is also think about how we can reduce the inflammation on the inside of our blood vessels. You know, we need to be very aware of if we are taking in niacin now, we should probably be talking with our doctor or healthcare provider about the discontinuation of supplemental niacin. And if you're taking niacin to help lower cholesterol, one of the things that we know is that there are other drugs that may be available to you to lower cholesterol, as well as dietary modifications and exercise. Talk with your doctor about what you can do to lower your risk of heart disease. That includes stopping smoking, reducing alcohol consumption, changing your diet to a more Mediterranean diet, making sure that you do exercise, also making sure that you take measures to reduce inflammation, and talk with them about whether or not you should continue or discontinue your niacin if you are taking it now. If you're not taking niacin now, I wouldn't start it given the data that we're seeing in this paper now. And certainly one of the things that we're going to be able to look at going forward is whether or not niacin should be added to food. If the findings bear out, and if the other authorities around the country and other people looking at these data feel that niacin is an important factor in this inflammation process in the blood vessels and potentially leading to increased risk of heart attack or other heart events, I think we may see discussion around whether or not niacin should be removed from the enrichment process when we talk about flour enrichment, for example. So stay tuned for further discussions around this topic. It's a very exciting change, and this is a very new finding. So please go ahead, share this video, do subscribe to this channel, and also, as always, please leave comments below the video, and I'd be happy to reach out and talk with you more about this issue. Thank you.